Welcome, everyone. We're here today to present the results of a new survey that's showing growing frustration and worry across the country when it comes to healthcare in Canada. Data you'll see shows that 55% of Canadians believe our healthcare system is moving in the wrong direction, with growing wait times for care, specialist referrals, and the fact that there are still about 5.9 million people without primary care. That's according to the Canadian Medical Association. And there is an accompanying strong message that 91% of the Canadian surveys want healthcare services to improve. There's frustration and a need for change. And in this webinar by Santis Health, you'll see all of the new survey data conducted by Nanos Research. It underlines that while there is geopolitical turmoil, tariffs, and wars and conflicts, and those dominate the public discourse, healthcare remains one of the top three key issues among Canadians surveyed. We know there's burnout among health workers. We know that people are leaving the profession. We know hospitals are in debt and cutting staff or curtailing services. And there have been deaths in some cases where patients have looked for emergency care. It's all causing distress. So now a closer look at how Canadians feel about what's going on and what we can learn. And so joining us now with the results of this pulse taking is Nick Nanos of Nanos Research. Hi, Nick.
Hey.
And Patrick Nelson, managing partner at Santis Health, which commissioned this survey. Welcome to you both, Patrick and Nick. And let's start with Nick, who will take us through the findings. And after that, Nick and Patrick will discuss some of the messages that are taken from the information and the implications for health leaders. So over to you, Nick.
Thanks a lot, Avis. The interesting thing is that, the fact of the matter is that when you distill this Santis study on healthcare, that it really puts a spotlight on urgency, frustration and worry, and openness to innovation. And that maybe that means that we're really in a sweet spot. If we could look at the study that was done, what's clear is that we are at a moment in time. We can go to the next slide. And that there's a significant opportunity. One of the key things is that when you look at the long-term trend line, the pink trend line is the Nanos long-term trend line on healthcare. The blue trend line is the spike, the pandemic. But to Avis's point at the very beginning, it really doesn't matter when you ask Canadians what their top national issues of concerns is. Healthcare is always at the top. And the reality is that whether people are dealing with healthcare decisions for themselves, for their parents, for their kids, or whether they're thinking that they will be dealing with those issues, the fact of the matter is that healthcare is always and consistently a top national issue of concern. But let's take a moment to kind of unpack what this new Santis study that we did kind of learned. And, we started off with an open-ended question, like, what are you worried about kind of deal? And, in this particular case, Canadians were allowed to say whatever they wanted. And you can see from the results that the top unprompted national item that people talked about that they were worried about when it came to how healthcare is delivered in Canada today had to do with long waits for care. You can see 1 out of every 4 Canadians identified that. And then you can see basically tied for second, poor access to services and shortage of healthcare staff, shortage of doctors. So you can see kind of the interplay of the anxiety and worries and concerns that Canadians have when it comes to how healthcare is delivered, the waits and access, and then basically staff. Do we have the healthcare professionals needed in order to provide the access in a timely fashion? And when we look at a breakdown by age, gender, and region, we can see some outliers, and you can see kind of highlighted in Quebec. Quebecers were more likely to identify poor access to services compared to other parts of the country. And you can also see that young people, 31% of young people had identified access as middle-aged. And it looks like You can look at that older demographic, over 55 years of age. The reality is for them, they're probably on a particular path. They probably have healthcare providers. They're probably very knowledgeable about the system, and they probably have coverage of one set or another. So, the long wait times, and why don't we just add, Avis, they probably have time too. So the long waits for care, not as acute for that particular demographic compared to middle-aged and younger Canadians. But here's the kicker. One of the ways that we use to profile the respondents included whether they make healthcare decisions for other people. And you can see here that for individuals who make healthcare decisions for themselves and others, this concern about long wait care is actually higher than the national average. So you have to think of these Canadians who are really on the front line, right? They're dealing with not only their own health, making decisions not only for themselves, but they're making decisions for other people. The frequency of their interaction and their experience suggests that they can see firsthand that long waits for care is a significant problem, and they're quite worried about it. This was another open-ended. You can see the question on the top. If you had one piece of advice on how to improve Canada's healthcare system, what would it be? Open means that they could say anything. Now, and maybe, Avis, we can unpack this in the future. Canadians are not healthcare experts. There's not one thing that really pops on this in terms of what piece of advice that Canadians have to improve the healthcare system. And you can see a diversity of responses related to ranging from increasing public funding, expanding private healthcare, cutting admin. It's kind of like there's no clear consensus on what to do. And I think this speaks to the opportunity of experts, people in the healthcare sector, to start to engage. Because, for me, when I see there's no consensus, it's kind of like, well, there's latitude to do a lot of things, because there's not one thing that Canadians currently are fixated on as a single piece of advice to improve the healthcare system. So the bad news and the good news. The bad news is if ask Canadians what we should do, it's kind of like they have a whole bunch of different ideas. But the good news is because they have a whole different kind of range of ideas, there's probably opportunity to engage on a lot of these. And there's probably, I would say, political license to have discussions on a whole bunch of different things and initiatives to improve the healthcare system. Next slide. How do you feel lately? Oh my goodness. These are one of the numbers that really popped. And this is where we ask Canadians about words that would describe how they feel about the healthcare system today. So in this particular case, we gave them words, right? We asked them whether they felt hopeful, whether they felt confident, whether they felt indifferent, whether they were frustrated or worried. Well, can I tell you something? Everybody's got an opinion, because only 1 out of every 20 Canadians said that they were either indifferent or were unsure on this. However, check out the numbers. 39%, 4 out of every 10 Canadians say that they're worried. Worried is the top word that they would use to describe the healthcare system today. Another 31% say frustration. So you can see 7 out of every 10 Canadians are channeling negative words or negative feelings in terms of the healthcare system today. And only 12% are hopeful, and another 14% are confident. And the thing is, one way to look at this is that Canadians are almost 2.5 times, or about 2.5 times, more likely to feel frustrated or worried rather than confident and hopeful. But the key takeaway here, everyone's got an opinion about healthcare, and it speaks to why I said before it's such an important issue to so many Canadians. But that the mood today in terms of feelings about the healthcare system, overwhelmingly dominated by worry and frustration. And I think this should be a key message to elected officials. And this would also be a key message to healthcare practitioners, because think of it this way. Patients are coming into hospitals and patients are going into healthcare settings. This is 7 out of 10 are going to be worried and frustrated about the healthcare system and the experience that they might have. And I think this should be a big wake-up call for all the stakeholders in the sector, especially those that are delivering and those that are making decisions about how healthcare will be or could be delivered in the future. Next slide. When we look at the numbers in terms of differences by age, The fact of the matter is when you look at the top two rows, which is worry and frustration, that it is a majority opinion right across the board in terms of both of those. You can see Atlantic Canadians tend to be a little more hopeful. Maybe that's because of who they are and their culture, but we have to remember that sample size is 100 people. So the margin of error for that is plus or minus 10. It was outside of the margin of error compared to the national numbers. But I put that on the table just as an observation. But the key takeaway here is that when you look at worry and frustration, it basically cuts across basically every generation. Doesn't matter what gender, and it doesn't matter what part of the country that you're from. However, what you can see is that when we break out those different profiles of the number of interactions that people have with the healthcare system, compared to what type of decision maker that they are, you still see the same trend in terms of worry and frustration dominating the mindset. But you can see that those that interact less frequently with the system are more frustrated. Now, what we don't know, and as a researcher, I always have to point out the limitations. This could very well be because they've tried to access the healthcare system and they have not succeeded. And that's why they've only had 0 to 1 interactions, or that they've wanted to access healthcare, or they've self-selected themselves out because they think, I don't want to go to the ER. It's going to take too long for me to access my physician, or kind of other things that might come to mind. So you might look at that number and think, what's that all about? This could be kind of an underreported or underrepresented group of people that are frustrated, who are just self-selecting themselves out and trying to ride out, right, without seeking attention and medical care, some of the conditions that they have, hoping that they can manage it in the short term. Wow, not a great number, right? Healthcare system moving in the right or wrong direction. You can see comparing the right track to the wrong track, the right direction to the wrong direction. Canadians are much more likely to say that we're moving in the wrong direction. 30% unsure. And this speaks to, this particular number of 30% being unsure, I think links back to the fact that Canadians have no consensus on what to do to fix the system. And, the thing is I would hazard to say, as someone that's done polling, for 35 years, especially also in the healthcare space, that it's kind of like Canadians have heard it before from governments. They say stuff, they might spend money, they promise things, and then for one reason or another, it doesn't seem to have a material impact on the system, and it doesn't have a material impact on how people feel about the system. So maybe one of the things to take away from this is that although people are more likely to say that the things are moving in the wrong rather than the right direction, there's a lot of confusion and malaise out there when it comes to the Canadian healthcare system and whether it's moving in the right or the wrong direction. But what you can see, and this goes back to breaking out by region, age, and gender, is that younger people and middle-aged people are much more likely to say that that things are moving in the wrong direction, especially young people. And the thing is, if I could just share, in a lot of the other research that we're doing on a lot of other public policy issues, young people are frustrated about their financial situation. They're frustrated about the future. They're frustrated about the state of the economy. And this level of frustration, you can see, is also manifesting itself when it comes to the direction on whether healthcare is moving in the right or wrong direction, with younger Canadians under 35 years of age scoring higher on the wrong direction front than those that are older, and than the national average. But the thing is that you can also see Atlantic Canadians feeling fewer saying that it's in the wrong direction. The wrong direction is still tied with unsure. But the fact of the matter is that I think there's some kind of unique factors regionally that are playing out in Atlantic Canada. Next slide. Yeah, this is another number that popped. It's kind of like the more that you interact, and that's that column on the far right, the more that you're likely, to make decisions for yourself and other people, the more likely you are say it's going in the wrong direction. And this particular group of Canadians who are making healthcare decisions for themselves and for others are really probably the ones with the most experience, and probably the ones with the with the greatest diversity of experience, because they might be making, in addition to healthcare decisions for themselves, they're making healthcare decisions for their kids. They might be making healthcare decisions for their parents and stuff like that, or someone other family members. And I think this is kind of like one of the key findings and one of the key themes throughout this whole Santis study that we've done, is that those folks that are probably most knowledgeable as patients and as decision makers, healthcare decision makers within their family, are the hardest. They're the toughest. They're the ones that are worried the most. They're the ones that believe that are most likely to think that things are moving in the wrong direction. Appetite for change. I'm surprised we were able to fit the 1% and 2% on that slide. So just so you know, 1% of Canadians say it's unimportant for the healthcare system to change. Another 2% say that it's somewhat unimportant. This speaks to the massive appetite. And at the very beginning of the polling brief, I talked about we're at a moment in time. This particular data point speaks to the fact that we are in a moment of time. And to put this into context, governments usually win elections with 40% support. The fact that 9 out of every 10 Canadians agree on anything is actually quite striking. The fact that 2 out of every 3 score their level of intensity of importance quite strongly compared to the rest speaks to this idea that we're at a moment in time, and that Canadians are ready for change. I think the fact of the matter is that over the last 20 or 30 years, they've heard a lot from governments federally and provincially, but that they're frustrated, they're worried, and that this whole idea of change happening, this appetite for change, is exceptionally strong right now. That intensity of change and that appetite for change. Atlantic Canadians want to see change, but the fact of the matter is it's hard to see anybody in any region or demographic that say that it's not important to one extent or another to see that type of change. Next slide. Openness. Okay, now we're going to pivot now to talk about openness, because what we've done is we've established that people want change. We've established that people are worried and frustrated about the system. We've also established that when we ask people for advice, they've got a whole bunch of different ideas. Nothing really jumps out. What we did was Nanos worked with the Santis team to put on the table a number of different initiatives or things that could be done. And we wanted to test on the level of openness, or people not being open to these proposed kind of actions. One of them, this one, having to do with having a healthcare provider use artificial intelligence to assist with diagnosis and treatment plans, right? The thing is that you can see that a majority of Canadians are more likely to be open or somewhat open to this. There's still some Canadians, you can see, 3 out of every 10 that are somewhat not open. I guess the people that are completely inaccessible would be that 14%. But the thing is that you can see here that there's a level of openness when it comes to healthcare providers using artificial intelligence as a supporting mechanism, as something to assist them in the in kind of their delivery of healthcare to patients. So the thing is that what we're seeing here is a certain level of openness, especially from a majority of Canadians. But there's still some people that, hey, you know what, want to see how that could work. Virtual care. The thing is, you can see the level of openness for virtual care and digital tools to consult with health providers much higher than the AI. The AI is still strong in terms of a support to healthcare providers, but you can see that level of openness jumping significantly, where basically almost 8 out of every 10. We go from the 6 out of every 10 to now the 8 out of every 10 Canadians who are open or somewhat open to using more virtual care. The other thing that I thought was quite striking is take those 2 top rows, go across to the far right, people that are over 55 years of age. You know what? 8 out of every 10 Canadians that are over 55 years of age are good with using more virtual care and digital tools to consult with healthcare providers. So, you'd think there'd be some kind of technology play here, or you'd think there'd be some kind of anxiety over that. But what the numbers suggest in the Santis study is that there's a significant level of openness across gender, across generations, and across regions for using more virtual care and digital tools to consult with healthcare providers from home or health facilities. Next slide. Digital wallet. And the thing is one of the things we wanted to test on was a digital wallet. You can see here, same kind of numbers to virtual care. 8 out of every 10 Canadians say that they're open or somewhat open to having a digital wallet that they can own and control, allowing them to share their full medical history. The other thing that I thought was quite interesting is that you can see that the level of outright openness among middle-aged and older Canadians, who are usually using the healthcare system a little more than younger Canadians, is actually even stronger, which speaks to, we talked about frustration. This digital healthcare wallet with 8 out of every 10 Canadians being open or somewhat open could be one of those things that could deal with those feelings of frustration that they might have with the current experiences that they're having in the healthcare system. Level of openness to having routine care and prescriptions from qualified professionals other than doctors. Okay, I'd like to say this is a touchy topic, but for Canadians, you can still see more than almost all Canadians. You can see only about 1 out of every 20 are not open to this. Wow. And you know what? If we're talking about change also has to include how we do stuff, right? And this does not mean that people do not want to see their doctors. That's very important for us to say. But what this does suggest is that there is openness for, other healthcare practitioners, nurse practitioners, physician assistants, pharmacists, to take a role, and in terms of the routine care. And I think the other important thing is this is part of routine care, not necessarily special care, but routine care. That there's a lot of openness, and you can see the numbers geographically. The intensity of openness is actually higher in British Columbia and Atlantic Canada. It's high right across the board. Like, let's face it, it's high across the board, but it's higher on the East Coast and the West Coast per se on that front. But even when you look at Ontario, where it's at 60 compared to British Columbia at 82, like, let's face it, 91% of Ontarians are open to receiving routine care and prescriptions from qualified healthcare professionals that are other than doctors. So we shouldn't torture ourselves over maybe a little bit of a regional variation, because the fact of the matter is it's still 9 out of every 10, basically in every part of the country. Allowing family doctors to be paid for care delivered by a team that they lead. Wow, there's been a lot of chatter about this, because obviously this is one of the things that many people think about and talk about. And you can see a pretty good level of openness. The intensity of openness is not as strong as some of the others, but when you look at the people that are open and somewhat open, you're still looking at 8 out of every 10 Canadians. And that number really jumps. That intensity of openness really jumps in British Columbia. And when you look at that 18 to 34-year-old cohort, where it's still about 8 out of every 10 or thereabouts that are open or somewhat open, that intensity being a little lower, I believe, based on the other research that we're doing, a lot of this has to do with the financial pressure that young people are under. Our polling suggests that about 28% of young Canadians are worried about paying for the groceries this week. So I think maybe this should be the sensitivity, that discussions related to allowing family doctors to be paid for care delivered by a team that they lead, that there will be a sensitivity among younger people, even though it's still a strong proportion are open to this. There'll be a little bit of a sensitivity just because of the financial pressure that they are currently under, paying for housing and paying for groceries and the rising cost of living. Openness to allowing private organizations to deliver publicly funded, you can see, surgeries and diagnostic tests. You can see here that 6 out of every 10 Canadians are open or somewhat open, but check it out. Go down the list. You can see the proportion of Canadians that are outright not open, we should take note of that. 1 out of every 4, right? So, on a lot of these other measures of openness, it was like only 1 out of 20 Canadians were not open to that, which means there's a lot of latitude and license to kind of engage in those areas. To go down this particular path, we'll need a little more, if I can use a hockey metaphor, since we are Canadians, that it'll require a little more stick handling. Doesn't mean that it can't move forward. Doesn't mean that you can't manage it. Doesn't mean that you can't build on the fact that still 6 out of every 10 Canadians are open or somewhat open to this, but there's just a little bit more stick handling. And you can see stick handling, province of Ontario, 33% say that they're not open. But still, when we look at the open and somewhat open and the somewhat not open and the not open in Ontario, there still tends to be more openness for this to be explored. So I think this is an opportunity to be explored. It might need a little more stick handling than some of the other initiatives that we tested on in this Santis study. Paying more in personal taxes, specifically dedicated to healthcare. People are struggling to pay for the bills. And, we talk about stick handling, connecting taxes. And, this is an important question to ask, because the fact of the matter is that there is no magic wand to the future of healthcare. And the thing is that in my experience, whenever we ask Canadians about whether they want whether they want to pay or whether someone else should pay, they always first say they'd like someone else to pay. That said, you can see that more than 4 out of every 10 Canadians are open or somewhat open to paying more in personal taxes if they're dedicated to healthcare. So this would be a heavier political lift. There could be a debate. Actually, why don't we just say there will be a debate on this, with Canadians not necessarily agreeing and being divided, because you can see 51% of Canadians or 52% or thereabouts are not open to one extent or another, while about 4 out of every 10 are. So there's division on this. So any discussion, so expect a debate. Anyone that kind of says we should be talking about paying more in personal taxes dedicated to healthcare, there will be a debate. Canadians are divided on this issue. Paying for out of pocket, same kind of numbers. So paying out of pocket for faster access to medically necessary services. Similar numbers to the other, except even a little more intense in terms of the lack of openness, where you can see that 6 out of every 10 Canadians are not open or somewhat not open. So think of this being part of the debate. The numbers are higher for the outright not open in the province of Ontario. It's almost 1 out of every 2. But the thing is this would be another policy discussion, healthcare discussion that would be a heated debate among Canadians and basically right across the country. Paying through private insurers for faster access. A lot of still division on this front. Although 40% or 4 out of every 10 are open or somewhat open, you can see that a little over 1 out of every 2 are not open to one extent or another. So kind of another division point. And you can see the Ontario numbers of sensitivity to pain, sensitivity to cost. And I think a lot of this has to do with the current context. And we have to remember, we did this study for Santis. This is in the context of an uncertain trade relationship with the United States. Ontario is the heartland of the automotive industry, of the steel industry. So there are a lot of Ontarians right now who are exceptionally sensitive to anything related to paying increasing taxes or costs. And that could be part of this, part of the specific kind of public opinion thread for the province of Ontario. Next slide. Making new life-saving medications available. So we kind of tested on kind of 2 options. Access to new medicines at the same time as other countries, or the lowest possible price. So price versus access. Interestingly, Canadians are much more likely, you can see, almost 7 times more likely to want to see an approach where they have access to new medicines at the same pace or time as other major countries. And they pick that over the lowest price. And you can see that particular appetite basically cutting across every single region, gender, and also all of the generations. So significant and a very clear message on that front. Best approach to improve healthcare. Hey, remember at the beginning, we asked people for a piece of advice and they had a whole bunch of advice? Well, how about this? Three-way tie, you know, on the best approach, where, Canadians, for all intents and purposes, in the same range, um, except for this concept, and you can see the 2% healthcare provided mostly by private care, with the public system playing a smaller role. So the mix, the appetite for the mix, you can see is there, but no clear direction on the best approach. So maybe we should chalk this up to another point of discussion for average Canadians, not just in terms of payment and costs, but also in terms of the mix between healthcare that's provided by the public sector and private care. Canadians are ready for change. This system, clearly from the perception of average Canadians, seems to be off course. They associate negative emotions. We talked about worry and frustration. There's concern about long wait times as part of this, and I will call it system failure, because we talked about people that are frustrated in the long wait times for them to access services. Not a lot of confidence, but there's openness. There's openness for some things to happen, especially technology related, especially related to access to medicines, and what I'll say, a debate that would take place on a lot of these other things. But I think that the fact of the matter is this appetite, or this belief that it's time to modernize, is actually quite striking and quite strong. Is there enough there for you?
Fascinating. I was nodding and shaking my head at various parts. It certainly reflects what I hear from people, and I think there's going to be a lot of debate about additional questions that need to be asked, because when people get asked about, they seem to be questions about leadership and confidence. We'll talk a little bit about that, but what I'd like to do is ask Patrick Nelson to why did you decide to do this survey? Because it's a little different than other health-related surveys. Why?
Well, first, we tried to make it different on purpose. We didn't want to have the same old survey, which was just about how crappy people think everything is. So we tried to dig in a little bit on that change sentiment, throw some ideas in there. We're really grateful to have been able to work with Nanos and seek his counsel through this. There's a few reasons we did this. First, this is really useful data for us and for our clients. So we intend to share it sort of widely and broadly with them. We are also planning to take a more strategic approach in how we put out information, to take some policy positions over the next year. So this data is going to support that policy work that we plan to do. We feel an obligation to be advocates ourselves in some areas, in primary care and women's health, in the integration of AI, to name a few. Those are things we're going to lean in on a little bit this year. I think it's also confirmation for the frustration that we're hearing from our clients on the ground. They're hearing from the people they serve, their patients, that people are fed up and want things different, and validation that governments need to be working hard to change, and we saw that in the numbers that Nick put forward. And lastly, Avis, I think you kicked it off at the beginning, and I probably shouldn't, but I'll call it a tire fire down south. It is really hard to get news, to get people talking about the health system in a much different way than 5 years ago when we were mired in COVID. So I think as advocates for the health system here at Santis, we felt a little bit of an obligation to do our part to put some information out there to try to stimulate a discussion in a different and new way. So not a panacea, but our contribution to moving healthcare up the needle a little bit.
Well, it's an interesting point, because some of the provinces would say, "Hey, we are trying things, we are taking initiative," but the sense from the survey is that people aren't feeling it. And there's one example: Ottawa has been looking at funding nurse practitioners and midwives, I believe, to make it part of the provincial health systems. But some of the provinces are dragging their feet on that sort of innovation. Do you have other examples on this?
I mean, the first thing is just to acknowledge that moving this big ship, we call a health system, around takes time. There's lots of unusual things within our cherished Canadian health system. You commented on a few. Nurse practitioners and some others aren't mentioned in the Canada Health Act, so there's been a sort of gaping loophole. Things like home care, people are paying out of pocket. Long-term care, people are paying for. So there. I think ambulances, if you take an ambulance ride, sometimes you pay for it. There's lots of things that we would call medically necessary that don't necessarily fall within our guardrails. I've been doing work in the health system for 25 years or so, and it is cyclical sometimes. The things we talk about. When I worked in government, we were working hard to build new long-term care homes, and then the system stopped building long-term care homes for a while. Who knows why? Now we're talking about it again. We're building homes, but we're really playing catch up. I think the same is true for medical school spaces in the early 90s. We, as a health system, I'll use that charitable we, stopped. Actually, we cut back on the number of doctors we were training every year, and now we're doubling down because we're looking at the health workforce and saying, "Sheesh, we need to make doctors again." But it's another example. This system takes a long time. It takes us 7, 11, 12 years to train a doctor. So those announcements we're making now, we're not going to see the benefits of that for a decade almost. So it takes time.
It certainly points to the need for longer term planning that doesn't get changed when it comes to healthcare, because some of these are 25, 30-year decisions. So, Nick, one of the key things that I was interested in is you looked at loss of confidence. What are the implications if people are not confident in the healthcare system?
Well, they're just going to be angry. It's, like, let's face it, it's going to go from worry, frustration to anger. Like, I think that can escalate quite fast, but building on Patrick's point when he talked about, it takes time. And, it obviously takes time because we're talking about structurally changing how we deliver and how healthcare in Canada works. However, and I'd like to have, however, my favorite part of this study, and I just like to say, asking Nick what his favorite part of the study is like asking me which one of my children I love most. But my favorite part of the study was working with Santis on these initiatives on what people are open and not open for, because I think that means that we can have conversations. And I'd just like to pick up on one thing that was part of that battery that Santis kind of developed in terms of things that people might be open or not open to, and that's the digital wallet. I'd always kind of say that you need to have, and you got to have a long-term strategy, obviously, on healthcare. But if there's a short-term win where people can say, hey, we can actually do something, I think I would put kind of digital wallet, virtual care, those types of things at the top of the list, because what we have to show Canadians is that we can do a better job, that the system is responding. Because to tell people, to tell people it's going to take a long time to fix, which is the truth, we have to tell them the truth. We also have to give them a little hope. So I would hope that for elected officials and governments and healthcare experts, that they look at some of these things and go, hey, is this a low-hanging fruit that we could do so that people can see, yes, we need to talk about the mix of private versus public. Yes, we need to talk about how it's funded, all that kind of stuff, and who does what. We need to sort through that. But are there some shorter term? And you know what? Patrick will probably correct me. Maybe a short-term win is like 5 years. Not, do you know what I mean? But I think those ideas that Santis put on the table in terms of what people are potentially open to should be seen as opportunities to say maybe we can move forward on some of these things so that we can have fewer people feeling worried and frustrated about the healthcare system.
Patrick, did you want to add anything to that?
I mean, there's lots of, all things aren't horrible across the country. There are so many examples.
Yeah.
Where governments
are there examples where you see regions moving ahead in a way that people are getting the care they need more quickly?
Avis, for sure there are. I think the challenge in our health system, and there's been reports that are decades old, which used to say, if we could just take those pockets of examples of innovation that are working really well and spread them out faster. We have this terrible habit in Canada where we do pilot projects for everything all the time. So something gets tested in one province, and then, two provinces away, we say, oh, well, maybe it's working there, but our province is different. So yeah, there's examples. I think there's a few that come to mind. So BC and Ontario right now are all in on primary care teams. They're not the only ones. I think primary care is sort of top of mind for folks right now. So incentivizing doctors and other health professionals to work together has been a focal point. Ontario and BC are spending an enormous amount of time on that. They're changing the way that doctors are getting paid. They're saying, let's get rid of the paperwork. I don't think that's a new idea. We've been talking about team-based care for 20 years, but I think patients are starting to see the benefits of that. There's been scope of practice changes right across the country in a different way over the last 5 years than there was in the 15 years prior. And I think we have seen some of those health professionals be less adverse to changes. Right here in Ontario, pharmacists are doing a whole bunch of prescriptions for ailments I'm sure you guys are both in Ontario, but I think real patients are going to their pharmacy first now to get prescriptions for things. So we're removing that backlog from family docs' offices. Nick talked a lot about in some of the data just how Atlantic Canada seems to be a little more hopeful. Having done lots of work in Atlantic Canada, I think Atlantic Canada has some benefits. They're smaller. I think their health workforce problems there are bigger, so they can move faster. I often refer to the time I called a minister's office in one of the Atlantic provinces, and the minister himself answered the phone. Like that wouldn't happen in any other province. But as an example, in Newfoundland, they're now doing and rather than saying, oh well, we're going to have to wait to recruit family doctors to train them. They're offering virtual primary care to all Newfoundlanders who don't have a family doc. I think that's an exciting innovation. They did it really fast. They're keeping their ERs open rather than closing them by having a virtual care option where the nurses are working with a doctor who's elsewhere. So there are absolutely some exciting things happening. I think if we can replicate some of those things, learn from them, not take a bunch of time to do pilot projects, I think we'll see that innovation and change happen faster.
Okay, just a couple of questions before we wrap up. I did notice that in the data, Nick, that people did talk about 9% increased public funding and cutting administrative layers and red tape. It almost looks like accountability question. I'm not sure because there's a lot of money. What did the provinces get? Like $57 billion this year to do it? Is it being spent properly? Seem to hint at that a little bit in
Yeah,
there.
I think I would agree with that, Avis. There is that subtext for a lot of people that know that there is money. There is money that is in the healthcare system, um, and but at the same time, that and a lot of these enterprises and a lot of these initiatives, what they want to see is less money spent on overhead and administration and more money spent on delivery. And that they expect the same thing from charities. They don't want charities to have big administrations. They want charities to deliver impact on their social good that they do. And I think they apply that same kind of view when it comes to healthcare. And they know that we need people to administer our healthcare system. But the question is how many do we need? What is the right number? And how does that mix look compared to healthcare that's delivered?
So last question, Patrick. So what message would you have for national, provincial leaders, health industry leaders about this message? Like, what would you say the take home is?
Well, that's a tough question. It's easy to armchair quarterback from the sidelines and say, "Oh, look how easy it is. You can just do this and that and this." You can see the conundrum in some of the later slides that Nick put forward. So we want change. We want more AI. We want more doctors. We want scope of practice changes. It's easy to say yes to some of those things, but when we ask those questions about do you want to pay more? The answer is inevitably no, and that's exacerbated right now with some of the affordability problems that we have. I think the big message is you have permission, perhaps an obligation, to take some risks when it comes to making changes in the health system. Uh, but if you're going to do those things, Avis, you and I were starting to talk about Prescribe IT and some of the challenges that we've heard about.
Yeah, these are government ventures from many years ago
Yeah,
trying to improve and speed up things, and all
yeah,
people see are wasted money,
yeah.
controversies, and it makes people think, well, maybe, they can't do healthcare. So that's why they start looking at other options.
Yeah, so the goal of connecting pharmacists with doctors so that we can automate prescriptions, both sending and receiving. Like, who would be against that? But I like the big miss there in my head is that the users, the pharmacists and the doctors didn't buy into that particular version of the program. So to governments, take risks, but make sure you bring the people along with you, and don't delay things because of resistance to change. Delay things because the numbers don't make sense or the evidence doesn't exist.
Last word to you, Nick.
We're at a moment in time, Patrick just put his finger on it. It's time for things to change. People want change. This is important. The other thing I'd like to put on the table is as soon as things stabilize with our relationship with the United States, this is going to be the top issue of concern. This is going to be ramping up. So, you know what? Get ready. Get ready for this to be at the top of the agenda for Canadians once we have more certainty on the economic front, because that's usually where it is. And it speaks to the imperative to talk about new ideas and to push down those numbers on frustration and worry.
Yeah, important message there. So for people who are watching, you can read the complete report. It'll be posted at santishealth.ca. And thank you to Nick and Patrick. We're all hoping this sparks discussion and solutions, because I know that Canadians really value the healthcare system and they want it to work for all when they need it. Thank you.